First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, and to promote recovery. A very good afternoon to all the students present for this talk. I, Mrs. Karuna Sattaradekar, Associate Professor at GVM's Dr. Dada Vaidya College of Education, welcome you all for this online meet on first aid. Today we have gathered here to give some immediate information to our dear students on first aid. First aid is one of the required activity to be conducted for the students, and particularly students who are studying to become teachers. This will definitely help our students in their career as teachers. Since March 2020, all over the world, people are facing the problem of corona. Due to corona, teaching has changed to online teaching. And today we have first aid program online. Today we have with us doctors to give authentic information on first aid to our students. On behalf of Goa Vidya Prasarak Mandal's Dr. Dada Vaidya College of Education, our principal, Dr. Jojan Matthew, the teaching staff, the office staff, I welcome you all. Sir Principal is not on the campus, but he is there online. I request Sir Principal Dr. Jojan Matthew to welcome the gathering officially.
Hello, are you able to? Yes?
Yes, sir.
Okay. Karuna, are you able to hear me? I can carry on? Okay. Yeah, okay. A very good afternoon to all of you. I would like to apologize to the doctors that I was not available to receive them in the college because of some other preoccupations. And Dr. Raju Usgaokar and Dr. Mrs. Nutan Dev and the organizing committee members, Mrs. Karuna Sattardekar, Ms. Prajakta and Mr. Diptej, and all the faculty members and my dear students. As Mrs. Karuna Sattardekar reminded you, this is a very important program in our syllabus. And we teachers, we not only deal with information and ideas, we also deal with students. We deal with people. So it is very important that we need to know about first aid. May I request all the students to mute your mic?
Then he started, I came to know he must have done something wrong.
Shreya, please mute your mic.
This is a learning experience. This
कोणीतरी माईक ऑन केला.
Yeah. Yes. No, I was trying to tell you that we not only deal with information and ideas as teachers, but we also deal with people. We deal with students. So it is a compulsory component of our B.Ed program that we need to undergo this first aid program. See, I would like to tell you that suppose a child faints in your class, you don't know what is actually happening. Maybe the child may have a history of epilepsy or something. So as a teacher, we should be able to differentiate. We should be able to find out what it is, and we have to do the needful. See, last year, what happened in the state of Kerala, one child, she was bitten by a snake in the classroom. See, actually, there was a hole in the classroom, and the child, put her leg inside, and it was a very big hole. And some teachers came and they said it was nail or something like that. So later on, what happened, the child became unconscious. She was taken to the hospital and finally she died. And it was a very big issue in the state. So what I am trying to tell you is that as teachers, it is very, very important that we need to undergo this training of first aid. And today we have two eminent doctors, Dr. Mrs. Dev, and especially we, we were part of that Vidyalaya management committee of Kendriya Vidyalaya, and also we were in some committees. And I always see her, giving wonderful suggestions. And last time when we were in a meeting, she said, especially she asked the chairman that why not we give some scholarship to the needy people, the poor people and all that. She always has that concern. So I would like to welcome you, Dr. Mrs. Nutan Dev, to this program. And Dr. Raju Usgaokar, I don't know how many of you know him. He's one of the best plastic surgeons, not only in Goa, I would say in the country. And I have referred some cases to him. I know he is very, very efficient doctor. And we are really privileged to have these two eminent personalities, doctors in our midst. And I'm sure that all the students who are attending today will really benefit from this talk. And those who are not attending, we will ask them to produce a first aid certificate course which they have undergone from somewhere else. So actually, those who are attending today, you are all very, lucky people that you don't need to undergo the training again. Otherwise, we would ask you to get a certificate, because this is a compulsory component and some students may be taking it lightly. Once again, I would like to remind all my teacher trainees that this is a very important component, and we have two eminent doctors, personalities to clarify all your doubts. So please pay undivided attention to all the things that they say. Once again, I would like to welcome all the faculty members and the students also to this program. Thank you very much.
Thank you very much. Thank you very much, Principal Sir, for your kind words and for your sharing your experience on snake bite. I'm sure all students will benefit from this particular program on first aid. Just a reminder to all the students, a link will be shared in chat box maybe at around 4 to 4:30. That particular form you have to fill, give your feedback and send it back to the college, and that will be considered as your feedback form and your attendance. So please pay attention when the lecture is on, when the program is on. Some questions will be asked. You have to fill in the form and send it back to us. Thank you very much, sir, for your official welcome. Let me now invite Shri Vinayak More sir to introduce the faculty for today, Dr. Raju Usgaokar.
Good afternoon, all. It's my honor to introduce today's guest speaker, Honorable Dr. R.P. Usgaokar. He is renowned consulting plastic surgeon in Goa. He had his medical training at Seth G.S. Medical College and KEIM Hospital, Bombay, which is one of the top medical schools in India. He graduated in 1975 and then completed his post-graduation in general surgery at this busy hospital. This was followed by obtaining the MNAMS degree, which is in 1978, which is awarded by National Board of Examinations, New Delhi. Subsequently, he shifted to UK for further studies, and while working exclusively in plastic surgery, obtained the fellowship of the Royal College of Surgeons of Edinburgh, which is famously known as FRCS. And when the super specialty examinations were started in the UK, he went to pass the FRCS. This prestigious exam is conducted by the Intercollegiate Board comprising of all the 4 royal colleges in England, Scotland and Ireland. He had an excellent academic record, having passed all these exams in the first attempt, and also has distinction of the being first FRCS to start practice in India. In the UK, he worked exclusively in plastic surgery in various capacities in eminent hospitals. He also worked as a locum consultant plastic surgeon in the hospitals for the total period of 3 years, and in all his training work in plastic surgery in the UK was for more than 8 years, during which he had extensive surgical experience. He is also life member of various associations like Association of Surgeons of India, Association of Plastic Surgeons of India, Indian Society for Surgery of the Hand, Association of Rural Surgeons of India, Indian Medical Association, and he is also fellow of, as I earlier mentioned, he is also fellow of the Royal College of Surgeons of Edinburgh. He has been actively involving in teaching activities too. In spite of his busy schedule, he currently teaching faculty at the flap dissection course at the KIM Hospital and BYL Nair Hospital, Mumbai. He is also faculty on the hands-on Ethicon microsurgery course at the EISE Mumbai. The faculty for Kenisburn courses in microsurgery, flaps and preparatory courses for FRCS plastic surgeon examination. All the courses are highly rated in the UK. He is also on the editorial board of Indian Journals of Plastic Surgery. He is regularly involved in various conferences, CMES and workshops to keep himself up to date. Being local secretary and instrumental in organizing two international and two national conferences in Goa from 1992 to 2010. Currently, in a private practice in Goa, on the visiting panel of Municipal Goa Hospital and Victor Apollo Hospital, among others. I would like to welcome sir. I would like Dr. Karna ma'am to felicitate sir.
Thank you.
Thank you, sir. Floor is yours.
Good afternoon, everybody. This is a new
You are starting the presentation, sir?
This is what? Anything else you want me to say? Okay. Good afternoon once again. It's a new experience for me talking to an empty room. Usually I used to be part of this lectures series for quite some years. I've not been part of it for the last 4 or 5 years. But every time it was a full hall of about 100 students, packed benches, and only the boys sitting on the last bench. It's one axiom and a principle that in all our conferences, that the talk or lecture after lunch is the most dangerous one, because all the blood supply after lunch goes to your stomach and intestines, very little blood supply goes to the brain, and so people are not in a receptive mode. So usually the talk after lunch is given to the most boring topic or the worst speaker of the day, so that students can enjoy a little rest. So I think you will be excused if you doze off during my presentation of the next 1 hour, but keep your mics muted and do not snore, please. As Mr. Matthew said, your principal said, the key difference between people from other professions and you as future teachers is that you are not only dealing with ideas and intellectual things, but also with people, like we doctors do. And everything now can go online and work from home, but we have to deal with patients, and same way you will have to deal with students in a classroom somewhere or the other. So you have in charge of maybe 50, 60 students, and somewhere there something can go wrong. And the classic simplest thing that can happen in most schools at the primary or early secondary thing is during the interval everybody rushes out to the door, 2 students collide, one falls and hits his or her forehead against the corner of a desk, and there is suddenly blood spouting and a wound that creates panic amongst everybody else. So first aid training is very justifiably, I feel, mandatory for all teachers, because you will have to deal somewhere, sometime with some crisis, medical crisis. Apart from that, it's always good as a member of society that you are aware of these principles, because anywhere in society, whether in a shop, whether you're traveling in a bus, train, you can be called upon to give some help. The history of first aid is nothing new. We will just skim through the slides here. As you can see, it was started the Order of St. John in 1099, so it's 1000 years now. The Red Cross was formed in 1863, whose purpose was to give aid to the sick and wounded soldiers in the field. In 1877, the St. John Ambulance Association is formed to train men and women for the benefit of the sick and wounded. Red Cross, because of religious sensitivities, its association or its perceived association with the Christian religion was also renamed as Red Crescent for their humanitarian work in the Muslim part of the world. So the first aid term is supposedly first appeared in 1878 as the first treatment as contributing to national aid, and 1880 was the first book published. This is a key term, first aider. So anybody who has got some training in first aid and is capable of providing first aid is called a first aider. This term was coined in 1894. And St. John ambulance, this is a primitive ambulance far remote from the 108 that you see on the roads today. Now it's worthwhile going through this slide because this is the motto of, I think, St. John ambulance. Remember, this is an 8-pointed ambulance cross. So what are the things that matter? Resource. You have to have the resources in your mind as to what needs to be done. Dexterity is ability to do things with your hands. Next is sympathy, which is very, very important. Because in a first aid situation, very often you're not in a position to do anything definitive. But just being there, providing solace to the person, reassuring him or her that things will be under control, you are not going to die, you are not going to bleed to death, makes a big difference. You have to have perseverance because everybody there is going to be in a panic mode, hysterical, and you have to persevere and do your things calmly. Discrimination is knowing which is condition is good, which is bad, or which is deserves a lot more treatment. Explicitness, be clear in your instructions. Observation and tact are, of course, part of life anywhere today. So as they said, as first only doctors could teach first aid, but now you can have first aiders training other first aiders. And the stronger focus is on practical skills rather than knowledge of anatomy and physiology, which is part of the medical curriculum. We don't need to go through these slides, but you can, if they are available to you, you can go through them. This is anatomy of the various parts. So what is the purpose of first aid? The purpose of first aid is very simple, but very vital. First aim to preserve life. You do your best to make sure that the person stays alive. Your first steps that you take in the first few minutes can help in promoting recovery of the patient when he or she is on the path of getting better from that incident or accident, whatever it was. Take measures to make sure that whatever has been the damage, the worsening of that will not happen and the casualties condition will not get any worse. And of course, finally, arrange transportation to hospital. Now, here is what I would like to make a observation that Goa, we are blessed. We are a small state. We have a very efficient 108 system currently. So the needs for a first aider in Goa are very much different from the needs for a first aider, say somewhere in Uttarakhand or Jharkhand or something, where even getting to a primary health center can take 3 to 4 hours. There are no roads. People have to be carried in dollies or on horseback and all that. So in Goa, our first aid management is very often just giving the first few minutes of good care. Then somebody rings 108, they come and take over in less than half an hour. And whichever part of Goa you are in, you can be in a good hospital in less than 2 hours. The basic principles of first aid, A, B, C. Any major accident or something, you have to make sure that the person's airway is competent and available. Because finally, our life depends on our ability to breathe air and carry oxygen into our lungs. So if you think of the essentials of life, first is air, then is water, then is food. And probably nowadays it is air, water, internet and food, but that is only for the 21st century. Second component is breathing. Your airway may be patent, but the patient may not be in a position to breathe. For example, in an earthquake, you can have something crushing that person's chest, so they can't lift. So that you have to move that and make sure the person can breathe. Breathing has stopped, give artificial respiration. All that Dr. Nutan will tell you how to give CPR. And third is circulation. Circulation means with your airway and your breathing, the oxygen is entering the lungs, where its job is to oxygenate the blood. And this blood has then to be pumped by your heart into all your tissues. So that is circulation. If the blood does not reach the tissues and provide oxygen to all the tissues, particularly the brain, then it has no meaning. So in initial assessment, make sure whether the patient is conscious, not conscious. You take the person's name, you shake him or her, call out, try to move, try to pinch to give a painful stimulus. Then there are certain measures to be taken to make sure that they don't have difficulty in breathing or choke on their own secretions. Open the airway. Opening the airway, you have to lift the chin so that the path from the nose into the lungs becomes more without any angles or without any blocks. Check for breathing. This, you can see that lady there, that she is taking her ears near the nose and finding out whether any air is coming in and out of that lungs. Check for circulation. Circulation, the indicator is whether the person has a pulse. The traditional way of examining the pulse is over the wrist. But if the person does not have a good circulation, you may find that this pulse is not very clearly felt. So another place is to check it in the neck, where you have one of the main arteries, which is called the carotid artery, which supplies blood to the brain, and that you can feel against one of the processes of the neck vertebrae. So that is a good place to check for circulation. Any of these TV programs and all that, where there are murders or this, the detective type programs, you will always find the police or the people checking for the pulse in the neck. Make sure there is no bleeding from anywhere else, and if there is any bleeding, then you have to take steps to reduce, if not stop the bleeding, because blood loss is very important. If you lose blood, you die. So what are the rules of first aid? Basic principle, these concepts have to be clear. Details you can always read from a book, but the concepts have to be clear. First, I think, is extremely well written. Make haste slowly. That means each step has to be done with precision and with forethought. If you just move to and fro like that, zigzag, it doesn't achieve anything. Each has to be one step further down the line. As I tell people, even after my surgery or something, and they have to have physiotherapy to get back to normal, I tell them, every day if you just do this, you are not improving your hand function. Every day you have to go a little bit more. If you are training for a marathon, every day if you run only 1 mile, you will never go through the 23 miles. So you have to do 1 mile, 1.5, 2 miles like that. So make haste slowly means each step has to build on the previous step. You should not just repeat things and not get any further. Accident site, you reach quickly. If you are a first aider there, inform people that you are a first aider. And this is where communication skills and all that come, because you have to be calm, methodical, quick, and inspire confidence in everybody else. Normal reaction in any injury, any emergency, is for hysteria to happen. Everybody is in a panic, everybody is crowding around the patient, and the person cannot actually get air to breathe because everybody is crowding on him. So clear the crowd. This you can do with authority. Say, I am trained in first aid, please go back, create a clear space so the person has space to breathe, and then you immediately assess the patient, look for all those things, ABC, give artificial respiration if need be, turn the patient on the side if there is vomiting, if there is an epileptic fit, sometimes they bite the tongue, so make sure that you can put something between the teeth. Stop bleeding, treat the shock, all that is not very relevant in Goa, I feel. This is important. Reassure the casualty. One of the biggest functions a first aider can do is to sympathize with the person and reassure that person that he or she is in good hands, will be taken care of, will be shifted to hospital without undergoing a major disaster. I take issue with this word here, disposal. I think it is transport to the nearest hospital or doctor. Disposal has a very sad sort of meaning to it. So again, another important thing, know your limits. Do not attempt too much. You are only a first aider. Your job is only to provide good consolation, basic care till somebody else more competent comes and take over. Like anywhere else in medicine, the scope of first aid will be that you have to diagnose what the problem is, whether it's, as Mr. Matthew said, whether it's a snake bite, whether it's an injury, whether it's a burn, it's a fracture. Give the appropriate treatment that you can do under the circumstances, and then, again, I will not like this word, disposal, it is decide where that person has to go. If it's a minor thing, you can say, okay, I've done your dressing, you can go home, take a paracetamol and take rest. Something bigger, you send to the local primary health center. If it is something really major, then you have to send to tertiary care institution like Goa Medical College. So this is, in medical terms or in disaster management, this is known as triage. Triage means you have to decide which category a person goes in. So if there's a major disaster and say an earthquake and you've landed up with 200 casualties who come to you, then you decide that these are the people who can be saved. These are people who are almost dead, you don't waste time on them. People who can be saved, who can be, you focus all your attention on them. So that, it's a bit like rationing, but it is mandatory or necessary if you want to give the maximum benefit to the maximum number of people. Diagnosis, simple. First of all, if the person can tell you history, the person will tell you what happened. That is not possible, then whoever has witnessed the event, say for example, there's an electric shock and the person falls down unconscious, then somebody will tell you that he was dealing with this wire and there was this spark or flash and then he fainted down. And other evidence around there to know what is happening. There's the evidence of a blast, some smells. And symptoms, the person can tell you that, okay, now I feel that after this my limb is feeling numb, or I can't move this limb, or it is extremely painful to move a particular joint, all that, whether I'm feeling faint, thirsty. Then diagnosis with signs is what you assess. So far we have said that what the person was telling you. Now, so the person has difficulty in breathing, you will hear that noisy, distressed breathing, there can be harsh sounds of breathing, smell, whatever. So there was a chemical leak, there was a burn, person has drunk too much and has collapsed, you can, there is smell of alcohol in the breath. And then see whether the patient has a painful expression, unusual chest movements, sweating and with bleeding from anywhere, blood is pooling under the person, abnormal skin color, needle marks, deformity, and feel again whether the person is cold to the touch, very high fever will be hot, the person has lost blood and is in shock or was exposed to a very cold temperature, abnormally cold body temperature. And by touching that person, whether any parts are painful, tender, with any deformity. Basic principles of treatment. These are principles, again, concepts. Remove the cause of accident if still present. This is very, very important. The person has been burnt on something and that burning agent is still on the person, remove it. If there's an electric shock and the person is in touch with a wire and is still convulsing like this, make sure that you switch off the electricity or take a piece of wood and push the person away from that. So remove the cause of accident if still present and remove the casualty from further danger. So there's a gas escaping and the person is inhaled it, make sure that you shift that person immediately out of that room into a room where there is no gas. Make sure the person is comfortable, which may mean that providing shawls, blankets if they are shivering, and all the time you talk to the person and say that, okay, things will be under control, don't worry. And then you do your assessment of all these parameters, airway, breathing, circulation, look out for any head injuries, fractures, and continue the treatment till the doctor takes charge. I again disagree with this word, but you take the person to the nearest doctor or the hospital by the quickest mode of transport available at that time. Here I will add, it is not just quickest mode of transport, but the safest mode of transport. So it is worthwhile waiting a few more minutes for the 108 to come because they are trained in moving a person. Don't try to lift the person in a very cumbersome way and put him in a rickshaw or a car and cause more damage by, particularly if the cervical spine was broken or something, you can render a person completely paralyzed right from the neck down if the neck twists in such a way that the spinal cord inside damages. So the quickest and the safest mode of transport available at that time. Funny. Okay, as a plastic surgeon, burns and scalds are something that I deal with and are close to my heart. Burns are an intensely or insidiously common injury everywhere in our society. And one has to remember that, like so many other things, with burns, prevention is far, far better than cure. Overall, we in India tend to like to lead a life of risk. So we cut so many corners and we'll end up with these unnecessary burns. Every day in the GMC or every week in the GMC, I get photographs of small children, 1 year, 2 year, 4-year-old children getting burned at home because hot tea spilled on them, hot water spilled on them. All that could be avoided if people take some precautions at home. And you have to remember that, like some other diseases like AIDS and all that, burns are not really a curable disease. If you have major burns, you will be left with deformities, scarring, ugly scarring permanently for your life. So you have to focus on prevention. You get a burn, you are in trouble. You may survive, but you will have significant sequelae afterwards. So small things. Now, for example, hot water, you don't keep it in such a place where a toddler can reach across and grab it. Nowadays in corona times, everybody was into taking steam inhalations. You have to take precautions on how that pot is balanced. You don't put it somewhere that it can topple onto the child, how hot you make it. Another thing that I tell people is, all of us have hot water, electric geysers in our house. Now that person gives you a sleek looking Philips or Racord or some beautifully decorated heater, you put it and you forget about it. On the bottom of each heater, there is a thermostat. So these people keep the thermostat at 70 or 80 degrees centigrade. Water boils at 100 degrees centigrade. So a burn is caused because you have a hot fluid, water falling on your body. How hot it is, how long it remains in your body will decide the depth of the burn. So if, for example, you have water at 50 degrees centigrade, then it has to remain in contact with your body for quite some time to cause a deep burn. Whereas water at 70 or 80 degrees centigrade, it can give you a deep burn in a matter of a fraction of a second or a couple of seconds. Goa is a warm place. Our body temperature is 37 degrees centigrade. So we don't really need that hot water. Our bathing water temperature may be at the most 45 or 50 degrees. So there is no need to have that thermostat set at 80 degrees. Because the child goes into that bathroom and accidentally turns on the hot water tap, or somebody else has left the thing in the hot water position. The water falls on the child. Child is wearing clothes, so the water soaks into the clothes. It can cause crippling deformities in the child, and the child is going to suffer for the remaining 50-60 years of his or her life. So this is one thing. So all these small things if you take. Now another thing, you call any person home, any handyman home, whether it's an electrician, a plumber or a carpenter, they will stick 2 wires into the socket hole of the electricity. They don't bother about a plug. This is inviting trouble because you can have a short circuit, you can get an electric shock. So these are small things that are worth thinking about seriously if you want to avoid the disaster of a burn. A burn is a disaster. So how do you define burn? So burns are injuries that result from any of these. It can be a dry heat like a flame. It can be a hot iron that touches your body, or commonest small dry heat that most women in the kitchen have are by touching the edge of the frying pan. They have little burns on their arms. It can result from wet heat. So that is the difference. Usually what you get from dry heat is called a burn. What you get from steam or hot water is called a scald. Other extreme also you can get a burn. So instead of hot, you can have cold. Now this is not really relevant because none of us are exposed to that much cold, but people who work with cold substances like liquid nitrogen, dry ice, freon gas, they can have cold burns. and the mechanism is almost the same because it denatures the protein in your skin. It can result from corrosive substances, which are chemicals, and chemicals are increasingly used in every aspect of our life. You know, my childhood, chemicals were hardly seen, but now anything and everything you buy has some chemical in it, and all the specialized products, what you use to clean your toilet, what you use for cleaning your glass, everything has some chemical in it. So that can create problems. Friction is a very common type of burn, and this is it is mentioned specifically because here you have two components. You have the burn that is caused by the friction, and also the injury that is caused by the friction. The commonest example is when you fall off your bike and get dragged along the ground, along the tar road. What happens is, because you are dragged along at a speed, you get friction causing a thermal reaction. That means you get heated up, so you get a burn, plus that tar road has scraped off the top layers of your skin. So you get a friction abrasion as well as a burn. So both add to each other. Radiation, commonest one is the sun's rays. So if you go on to Kolva beach at in the month of May and you're not wearing a proper shirt or vest, you will have a good day on that day on the beach, you don't realize it, and next day you'll find that all your back is hurting and it will form a little black layer. But this is a very superficial burn from the sun radiation. It will heal without any problems. And radiation, in terms of radioactive radiation, can also result in burns, and they can be a big problem. But that's something I don't think we have to worry about unless there's a nuclear war. Scalds are those caused by wet heat from liquids and vapors, and the reason that this scalds are can be damaging or can be worse is because there is something called the latent heat. That means when you have water, it has a lot of heat when it reaches a certain temperature. When water becomes steam, it will still remain at 100 degrees centigrade, but it has had an input of extra amount of heat to transit from the liquid state to the gaseous state. So all that will contribute to how bad the burn is. And as I said earlier, one more reason why scalds cause more deep injuries is because you are wearing some clothes, so the liquid soaks into their clothes and thereby remains in contact with your body for much longer rather than a flame that you just touch and come back. Okay. So these are the types of burns or the causes of burns. Dry burns will come from flames, contact with hot objects. Scalds will be steam, hot liquids, hot milk, hot tea, hot coffee, hot fat. Electrical burns we'll deal with separately. I'll talk on that. Cold injury, frostbite if you're climbing the Himalayas in winter, but I think that's not, no way we're going to get it in Goa, or contact with freezing metals, liquid nitrogen. Chemical burns can be a big issue, particularly I think in the teaching scenario for B.Ed people, you can get chemical burns while working in the chemistry laboratory. So be aware of what to do in that case. And radiation burns, not too much of concern. So when you're dealing with a burn, when you come across somebody who has just been burnt, what are the things that you need to look at? Now in burn, there are two aspects to consider to decide how bad this burn is in terms of its deleterious effects. One is how much of your body surface area is burnt. Now we are all covered with this outside skin on our body, and I ask people in those days when there was more interactive lectures, I would ask the students, which is the largest organ in the body? Can you tell me, Prajakta? Stomach is tiny. People talk about liver, brain, but actually the largest organ in your body is the skin. You don't look upon the skin as an organ because you see it every day. You know, the other organs which are deep inside, heart, lungs, they have a mystique around that because you have never seen it unless you have gone to an ultrasound clinic. But skin is a large organ, and it is a very vital organ because it protects you from the rest of the world. So any damage to the skin can cause, if your skin is lost, you can die because of that. Skin controls your body temperature, it prevents you from getting infection, If big burn, you will start losing blood, fluids, all that. So everything will that contribute to the process of death over a period of weeks. So how much of your body surface gets burnt is important. And sort of the old days we were told this axiom that your age plus your percentage of body burn, if that crosses 100, you are unlikely to survive the burn. The second component is, if you look upon the skin as a multi-layered structure, we have one type of skin cells on top, then another type of cells on top, then there is something called the dermis, then below that is the fat below the skin, then below that will be the muscle and bone and all that. So how much of that depth gets burnt? This will decide how deep the burn is, whether it will heal on its own or not. So to put it very simply, the extent of burn, that is how much of your surface area is burned, every time you read in the papers, you will say, you'll read something that X, Y, Z, this lady from Shiroda or something died in Goa Medical College yesterday. She was suffering from 65% burns or 70% burns. So that is what percentage of your body is burnt. They don't tell about the depth of the burns. Unless the depth is more, unless the burns are deep, you are unlikely to die. So the area of the burnt will decide what are your chances of survival. So the area or the extent of burn is vital to know what is the mortality. The depth of burn is relevant to know what is the morbidity of the burn. Morbidity means how much suffering. So give you a small example. If I have a deep burn only of my eyelid here, then the eye gets open like this. So I can lose sight in my eye because the eyelid has got burned. It is a burn which is infinitesimally small. The total surface area of this eyelid is hardly 2 or 3 square centimeters, but it's a very thin skin. If this gets burnt and my eye remains open like this, the eye dries out and I can go blind. So like that, if you have burns across a joint, as they heal, you'll end up with contracture, your fingers all get crooked, elbow joint goes, neck comes down like this. So all that, the deeper burns will cause the maximum deformity or what is known as morbidity. So what is a simple way to know if you are faced with a burn, how much is the surface area for you? For example, if you want to ring the ambulance and say, I've got somebody here, he's got 20% burns, 30% burns, how do you do it? This is one thing that is given in all the textbooks, which is the rule of nines. That means you divide the body into these parts: upper limb, lower limb, front of the trunk, back of the trunk, head and neck, and each of these has got a factor of 9. This is a convenient way of roughly assessing, but it is not always very correct, because this is applicable to an adult person. A child has a much bigger head. So the rule of nines goes awry in that. Plus, the other thing that happens is whenever you get burnt, the burning agent does not know this anatomy, so they don't, for your convenience, they don't say, okay, I'm going to burn only his right lower limb or his left upper arm. You get burns all over, scattered over the body, patchy burns. So there, what is more accurate is to take that person's closed palm like this, and that is roughly equivalent to 1% of the body surface area. So you get an idea of how much that is, and then map the burnt area. So you can say, okay, this person has now got burns 1, 2, 3, 4, 5 on the chest, 1, 2, 3 on this limb, 1, 2 on this limb, like that, and then you total it up. Okay, but remember, it is that person's arm, a palm, sorry. If you have a child and you take your palm, the child will be fully burnt and you will say it's only 3% burn. Okay, so it is a person's palm, and that is a more convenient way of getting a rough guide of what is the percentage of burn. This is a very critical slide, because it tells you what happens in terms of depth of the burn. Now, the skin is a very specialized structure. It contains what is known as epithelium on the top, epithelial cells. Top layers of that are dead cells, and they become thicker in areas where there is continuous pressure. That's why the soles of your feet are far thicker than the palms. If you walk barefoot, then your soles get really thick. You don't need a chappal in that situation. And below that, there are other structures that are part of the skin. You can see those sort of 2 or 3 things going down. One is a hair that sticks out on top. This is called the hair follicle, but again that is part of that same epithelium. The yellowish thing on the left is a sweat gland which creates all the sweat on our body. They are all epithelium. And finally, for a burn to heal, this epithelial layer has to become intact eventually. That is your protection from the outside world. So a very superficial burn, only the top few layers are damaged. It will heal very quickly. It is only characterized by thin blisters, redness, some tenderness. If you give good first aid, then will heal uneventfully. As the burn starts getting deeper, the epithelial elements get destroyed. If the top skin epithelium gets destroyed, then this burn has to heal from the epithelial cells that can come out from the hair follicles and the sweat glands and then spread across. This spreading across has to be there. Until all the epithelium covers the skin, it remains raw and is liable to all the problems. So the intermediate burns, partial thickness burns will take longer to heal, at least 3-4 weeks, and they will heal from the residual epithelial cells that come out of these sweat glands and hair follicles and all that. That's why if you have a burn on the scalp, it will heal much nicer because you have a lot more hair on the scalp. Not, of course, not me, but full thickness burn, the entire skin is damaged. And particularly with electrical burns, not only the skin, but the underlying tissues can also be damaged. What is known as the subcutaneous tissue, the muscle, the bone, everything. So this cannot heal locally. This has to heal from the side skin coming across, and this is known as a process of contraction. So if I have a burn here which is deep, as I heal, my arm is going to get into this position. I will not be able to straighten that arm unless I have surgery afterwards to release that contracture. Or you have to accept that this skin has been damaged fully, and at a very early stage go ahead with skin grafting, which is what we plastic surgeons do. So skin grafting, if done early enough, will prevent the contracture. Once the contracture is happened, it gets more difficult to release it and do the grafting. But the grafting will be needed and it will leave you significant ugly deformities. So management of minor burns, again we go back to that first principle, stop the burning process. Hot, remove the clothes quickly if they are hot. And best first aid is putting cold water on that person, because what happens is when you get burnt with anything, the skin layers itself act as a source of further heat. So the burn will keep getting deeper because that object of 100 degrees which contacted your skin, or the water that contacted your skin, has created a skin patch which is at 90 degrees or something. So that will keep on going further and further deep. So by cooling it, by putting continuous cold clean water, you are removing that heat sink and further damage to the deeper tissues. Okay. Remember, it is clean cold water for a few minutes. Do not use ice water. Do not use ice, certainly, because ice that you take from most modern freezers is less than minus 15 degrees centigrade. So you can actually compound the problem. You can cause a cold burn if you apply the ice for too long. So just simple cold water. If it's a baby and you put iced water or ice cold water, you can flip the person's temperature mechanisms out of control, and the child can land up with hypothermia and you have another headache on your hand. So stop the burning as possible. So fan out the flames, remove the hot clothing, immediately relieve pain and swelling. You can give whatever paracetamol or something that is around. Anything that is constricting on the body has to be removed immediately, because all the burns swell up very rapidly over the next few. I tell people that if you are unfortunate enough to have any of your close family members undergo a significant burn, then you will realize that if you go and see them in hospital at 48 hours, you will not recognize them, because they are bloated to almost 1.5 times their size, the way the body fluid mechanisms go inside. So if you have a ring on your finger, that ring at the finger swells can actually act like a choking thing, and your finger will die from lack of circulation because this ring is compressing the finger. It's nothing to do with the burn. So anything that is constricting, metal watch straps, rings, anything that you remove immediately. Cover the area with sterile dressing. I had actually put it in my car, but I forgot. I tell for all these first aid lectures that the best dressing that you can give to any burn patient is the cling film or clear film that is kept in the kitchens. What is it called? Kitchen film, clear plastic film that you wrap sandwiches and all that, okay? Because that is, it is made by heat process, so it comes naturally sterile. It sticks to itself, so you can easily cover it. Suppose I've got a burn here, you take that and roll it around, and it sticks to itself. Because it is covering the wound, it does not allow the burn to get dried with evaporation, so automatically pain becomes less. People have weird ideas about what to apply after a burn. They apply Colgate, they apply ink, particularly from Karnataka and all that. You have a child burned, you feel that Krishna has walked into your consulting room because it's covered from head to toe in ink. Now, of course, people use ball pens, so ink is not so much. And even cow dung, because it is supposed to have a cooling effect. Burnol is drilled into people's heads. All that they apply. Now, do all those things, then it gets increasingly difficult for me as a plastic surgeon, as the medical person, to see the burn because it is all caked with something. To try and wash it, remove it, I am adding to the person's pain. So if you put this cling film around, I can see it without removing anything. Then I can decide how I want to dress it, whether I want to dress it with ointment, keep it exposed, put collagen, like all the burns I can see there. It is a transparent film. So every school, make sure that you keep one roll of kitchen film as when the burn happens to somebody or the other. So all those other things, lotions, ointments, all that are not necessary. For a hand, you can even put that hand in a clean plastic bag. Because you stop the drying process, half the pain goes away, okay? Initiate rapid cooling of the burn by putting cold water. If major burns, this is relevant, but I don't think you'll have occasion to deal with that. So make sure that the person is breathing or of course, say it's an industrial accident, there was an explosion with hot blast or something, then you can have other injuries that stop the person from breathing. So all those ABCs of resuscitation are necessary for major burns. Otherwise, minor burns, just cold water, cling film dressing. Be aware that there can be associated other injuries, so don't forget them. This is what I said, do not use cold water, ice cold water, because you could cause hypothermia. Avoids removing anything that is sticking to the burn, because the burns are intensely painful, particularly if you are, nowadays of course dressing styles have changed, people don't use too many of nylon or rayon clothes, but those, when they burn, they stick to the skin. Burst any blisters, I will not enter into that controversy. Of course, as a first aider, you need not touch the burn. So I think all that you need to remember is have cling film, that's the best dressing. Electric burns are a different category altogether. Most of our domestic electrical supply is 230 volts. Outside, the supply distribution from the electric companies can be at 11 kV, which is 11,000 volts, or 33 kV, which is 33,000 volts. Any electrical injury from voltage of more than 1000 volts is classified as a high voltage injury. Anything below that is classified as a low voltage injury. Low voltage injuries are not that dangerous. And that's the reason why in all across the North American continent, their supply is at 110 volts. So even less problem of getting. So this is alternating current. What alternating current does is that it makes your muscles go like that. So actually, if you're holding a wire, you tend to hold it. You can't let go of it. And you have to remember that so much of our life process, my heart beating, my brain functioning, all this is an electrical activity. When my heart beats at whatever time per second, it is because something sends a little electrical ping impulse and the heart contracts. Muscles contract because they get an electrical. So electricity entering your body will spark off this electrical activity, nothing. So if for any electrical injury, there is a point of entry where you touch the electrical outlet or source, and point of exit where the current exits your body and goes into the ground. So if this axis is across your heart, then it can be a dangerous thing. In fact, it can stop your heart instantly and you can die on the spot. So you hear somebody died of electrocution, it is because the heart stopped when the current blasted through the heart. Even otherwise, they need to be, if they are surviving also, if you feel that the path was going somewhere in the heart, they need to be kept in hospital and monitored for their electrocardiogram for the next 24 hours or so. High voltage electricity is disastrous because high voltage will just blast through your body. You know, electrical injury for low voltage domestic that you get will take path of least resistance. You know, that's why one reason all the modern places you will not find any electrical outlets in the bathroom where the floor can be wet. So if you touch a wire or something, your cold water on your body and all that will divert some of that current. It is not going to go in. But high voltage will, every part of your body becomes a conductor for that electricity. And depending on what it is, the resistance is more, but it will still go through. So that current will go through your skin, bones, muscles, everything. Muscles, skin, subcutaneous tissue which have water are a lesser resistance, but it will go through your bone also, and the bone in fact inside might almost glow like a coil of an electric heater, but that 33,000 volts is going to go through, and then you get extremely deep burns. Everything is cooked from the inside out. All the other injuries, burn injuries, you are being damaged from outside in. High tension electricity, you are cooked from inside out. So you can have a situation, particularly if somebody working on this JCBs or something, they touch an overhead wire, we have to sometimes amputate that limb all the way from here, because leaving this can cause kidney problems and all that, and the person can die from that. This inside is all completely cooked. So you have to amputate that limb to make sure the person survives. So that's high tension, low tension. You will have usually full thickness burns. You will have this evidence of point of entry and exit with some degree of scorching marks. Major injuries, you will have signs of shocks. She will tell you about shocks. Shock means your circulatory system gives up, so you don't have decent circulation, you can't feel the pulse, you become cold and clammy, your tissues don't get enough blood supply. Another thing to be remembered in the category of electrical injuries, which gets very often labeled as an electrical injury, but it is not, and it is the safest thing to have, is what is called an arcing. That means if you have, particularly if you see on our roadside poles and all that, when there is a little loose wire, the current can jump from one, so 11,000 volts jumps from one electrode where there is a little gap across. So you get a bright flash, a spark. So it leads to a whole lot of ionized air there which reaches very high temperatures, but it lasts a fraction of a second. So it is not passing through your body, you will only get a coppery residue on it, and almost like the burn that you would get on Kolwa beach. It's very dramatic because you will have that big flash and everything, but the current has not done much damage to you inside. All electrical injuries, treat them with a lot of respect. They should be seen by a burn specialist. Even small things on the finger or something, a person working under a washing machine, he touches that wire. You have a deep burn on your finger. If it is not treated, the finger can lose function because inside your tendons, everything will get exposed and the finger will not work. Chemical burns, as I said, are increasingly common because everything, we have so many chemicals around us, right from car batteries containing sulfuric acid. So chemical burns, electrical burns, thermal burns. So first were thermal burns called. What they do is a process of denaturation of our skin or tissues. It's all proteins inside, enzymes, chemicals, the cell material is all protein. So just as when you put an egg into the frying pan and it becomes an half fry, this is what happens inside your cells. So the cells die. So a burn is a molecular death. You know what for example, what happens is I see somebody with a full thickness burn. For example, you fall off your motorbike and the silencer rests on your leg. You get a full thickness burn which is about this size. But the skin is there. So when I tell this person, look, this is a full thickness burn, let us remove that and immediately put a skin graft to heal you. they are reluctant because they feel the skin is not gone. If that person had a slicing injury with a knife and that piece of skin had disappeared and he was seeing red flesh underneath, when I tell him skin grafting, he agrees readily. But if the burn, no, because they feel it is insect. But it is molecular death still. That skin is, for all purposes, it is not existing there. So then they will always go to, that somewhere वाळपय गेल्यार तुका कितें तरी तें भाजून येवपाचें वखद खंयचे गाड्यार मेळटा. So all that thing will start. And then one thing that I have never understood in Goan Konkani is भाजून येवपाचें. Already तूं भाजून आयला न्ही, परत आनी भाजून कितें काम? You need something to counteract that buzzing. So chemicals, basic two categories, acids and alkalis. Acids are relatively better than alkalis because acids cause a process of what is known as coagulative necrosis. That means it falls on your skin, the skin outer layers get very thick. That is the basis of tanning. When you get leather, they use acids to tan that leather. So the acid does not percolate deeper and deeper very easily. Whereas fats don't do that. Alkalis don't do that. They have a different type of necrosis and they keep on percolating deeper and will cause more and more damage if left alone. So the first aid for any chemical thing is to wash, irrigate for 15-20 minutes continuously. Irrigation. So you are dissolving and leaching out the chemical. Where a thermal burn, you only need it for the first few minutes. It seems very logical that if you have an acid burn, and if you are in the chemistry laboratory, I got burnt with sulfuric acid, there is sodium hydroxide there, so why not neutralize the acid with the alkali? Would you suggest it's a good idea, Madam Karuna? Anybody? Never do that. Most dangerous thing you can do because of two things. One is any acid-alkali reaction is an exothermic reaction. It generates a lot of heat. So you already have a chemical burn, you're not going to add a thermal burn to it. Plus, when I'm trying to neutralize this acid with alkali, I do not know where the end point is. So actually I may neutralize all the acid and then start a burn caused by the alkali. So just dilute it with water and wash it out. Do not use any chemical neutralization. Okay, last. I have 10 minutes more. Wounds and bleeding. Again, this is part of my life as a surgeon. Any wounds will come to us for treatment and for suturing. So any abnormal break, I will not use the word skin as it is here, any abnormal break in the surface of the body or the covering of the body becomes a wound, an open wound. You can also have wound where there is a break in the tissues deeper to the skin. So the skin may not break. When you get a fracture or you get a muscle tear while playing, so all that, you can get a tear below the surface, but the skin may not break. But in general, what we talk about a wound is an open wound, so it is a break in the continuity of the skin or your mucous membrane. Everything from your mouth to your anus is another layer of your body. So you can get damage inside there as well. And that is one thing with chemical burns. Chemical burns can affect that because children sometimes will go and drink something which is there in the toilet. The bathroom which contains Harpic or something may contain a chemical and they'll drink it and they'll get burns of the food pipe and all that, which can be very, very troublesome. So what are the types of wounds? This is important just as general knowledge also, because this is what will give you a rough idea of how dangerous a wound is. Incised wound is the first one. Here it is physics. Why does a knife cut? Because the knife has got a very sharp edge. It is not the sharp edge which cuts, but the pressure that you apply on the knife is then concentrated on that tiny edge. So it has got enough per square millimeter, the pressure becomes so much that anything in front of that splits, whether it's a cucumber or whether it's your skin. So an incised wound is a very clean wound. So naturally it is the best in terms of healing because it is not going to get very badly infected. There's no tissue damage around, you're not getting all dirt from outside in. So a knife cut is a clean cut, it is the best one to treat. But beware that glass can be very deceptive. Glass injuries are extremely dangerous because glass not only cuts like a knife, but it can penetrate inside. So what you see on the surface may be something tiny, but you can have significant damage inside. Any glass injury, make sure that they get proper. There's small things like a glass injury, your glass breaks in your hand or a soda water breaks in your hand, and that glass piece goes inside here. It cuts the tendon. On the surface, you see only a tiny cut. But the tendons to this finger that move the finger get cut. So that finger is going to remain straight unless they have a surgery to repair those tendons. So glass, extremely dangerous. All that happens in the movies is complete eyewash. Tom Cruise or Ajay Devgan jumping or Salman Khan jumping through a glass, all the glass shattering, and then they spring up and run away like a panther. No, it cannot happen. If you mess with glass, you are in trouble. Laceration is where this, you go one step more on the physics. It is not a very narrow edge, but it is a more blunter thing. So your tissue split. You fall on a rock. As I said, the commonest thing that teachers will say is the students running away from class, and this corner a child falls. So what happens when the child's forehead hits this corner is, inside is my skull, which is hard. This side is a desk, which is hard. Anything in between, which is my skin, splits open. So it's a split, it is not a clean cut. So this has got more damage around it. Plus I could pick up some bugs from here, so there is more chance of infection that happens. Third is abrasion or graze. In Konkani it is called zarkatlo. Zarkatlo means only the top layers of your skin get rubbed off on a rough surface. This in terms of injury is very not all that great, not all that of concern. Unless, of course, as I said, that friction burn type thing, when you are on the road or something, you can have all the dirt that gets ingrained in your skin. That has to be removed quickly by a surgeon, otherwise it causes a natural tattoo. But one thing to remember in an abrasion is, you see our sensory system that gives us sensation, pain and all that, the nerves start from the brain through the spinal cord, and then they come here and then they arborize. Arborizes means like a tree, they become finer and finer branches and create quite a dense microfilament network under the skin. So in abrasion, a lot of those nerve endings are exposed. Suddenly they have been leading a protected life so far. Now that top layer is gone, they are exposed to the wind and the cold and all that, and they scream in agony. So the person who has an abrasion, in terms of first aid, maximally needs sympathy, not medical treatment. Okay, and what is our approach usually is, किने बवाल घालता तू मात्सो झरकटलाच मरे, but the झरकटला is the one who is maximally suffering. A deep burn will not get pain because the nerve endings are damaged, so they will not have pain. But abrasion, so give them sympathy, they will remember you for life. Contusion or bruise is that second category, which is closed wound, means you get a blunt impact and the blood vessels under the skin, the muscle, all that, they break and you get a blood clot forming inside. So there is no loss of skin outside, there is no cut in the skin. But because that blood clot is formed inside and has lifted up the skin, over days that skin could die. So all these have to be sent for medical attention. Puncture wound, again like glass, you can have what looks like a small wound, but it can be responsible for a whole lot of damage deeper inside. Gunshot is the worst. I hope I don't see that in Goa. But gunshot, because there is so much kinetic energy in that bullet, that not only it creates an entry and exit wound, but around that also there is a process called cavitation. So you get a whole lot of damage purely from the energy of that bullet passing through. Why are we worried about these wounds? A is because they can bleed and you don't want to lose too much blood. And secondly, because of contamination, it can result in infection. So they need medical treatment in terms of cleaning and stitching properly. You must know how to stop or at least reduce the bleeding, because this can be a common cause of death, too much bleeding. And the bleeding happens because there's a damage to one of the blood supply. Now, you'll all know from your biology things that our blood circulatory system is that the heart pumps blood, it goes through the main arteries, then smaller arteries, it reaches the capillaries, and then from there it is collected back and comes to the heart through veins. So which of these get damaged will decide the pattern of your bleeding. If a main artery is cut, then there will be a profuse bright red blood pulsatile, and you can bleed to death very quickly. Venous bleeding tends to be darker, more sluggish. Again, because the arteries are muscular, if an artery is completely cut, chances are you will survive because the artery will close down. But if it's a partial tear in the artery, it is very difficult. And the best way of stopping any bleeding like that is direct pressure on the spot. Do not apply a tourniquet proximal to that or higher up, because that can cause degree of venous congestion and the person will keep bleeding from the cut veins. Arterial bleeding, venous bleeding, capillary bleeding. Venous bleeding, one scenario that everybody should be aware of is we have quite a few persons now in society with what are called as varicose veins. That means the veins in the legs get dilated and they become very thin, they are distended, and a tiny injury, or sometimes even without an injury, very often the skin over that gets damaged, so they get a wound which is called an ulcer, and once in a while that ulcer can penetrate into that vein and they'll just pour blood, because you have the entire column of blood, weight of the column of blood from your heart down into your limbs, and from there they will just form a blood puddle on the floor. So anybody with a varicose vein gets that venous bleeding, simplest thing or the only thing you have to do is to put the person on the floor wherever he or she is and lift that leg. That will stop the bleeding immediately, because once that limb is elevated, it will not bleed. There is no venous pressure there. Don't try to apply tourniquets, they will bleed more. When you lose blood, you lose oxygen in the tissues, so all these symptoms come. That means you start feeling faint because your brain is not getting oxygen. Your skin becomes pale, cold, clammy, because your survival systems in the body make sure that no blood goes to these unnecessary parts of your body. All the blood is focused on your brain, kidneys. And you start breathing more and more because you want to get more oxygen into whatever blood is remaining in your body. So this is signs of shock. So bleeding, very often bleeding will stop by itself, the mechanisms of coagulation of blood. And otherwise, as a first aider, you have to take whatever measures you can take to reduce or stop the bleeding. Again, I said direct pressure is the best way of reducing the bleeding. This is just out of interest. There are very few places where you can press an artery against a bone. That's the only way you can feel a pulse. When we feel the radial pulse or the carotid pulse, it is because you are in a position to trap a pulsating artery between the bone in your finger and the bone of that person. When you have two hard objects and in between the artery, you can feel it thumping. Otherwise, any big artery you will not feel if it is on a soft substrate. So with injuries, whatever you can do to immediate clean, a little wash with soap water, bandaging she will talk about. One thing I will not finish without mentioning one of my pet peeves here, and this is something that I think is the strongest take home message from this. Be very, very careful about Dettol. Dettol is hardwire advertising. It is hardwired into our brains. Dettol se Suraksha, Dettol, Dettol, Dettol. What happens? Dettol is a good antiseptic, disinfectant, whatever you want to call it, but it is a harsh chemical. If you buy a bottle of Dettol, it is written in letters which you have to use a macro lens or a magnifier to say that dilute well before use. Nobody reads that. So you have a scenario where the child comes crying from the playground because I have got a little graze on my knee, and the mother she is busy because she has to cook and she has to do so many things. She pours Dettol on a cotton swab, just does one arti below the tap and applies it to that child. So the child who had an abrasion which would have healed in 4 days now has a chemical burn from the Dettol which takes 6 weeks to heal. I've seen this time and again. So I tell people, do not keep Dettol in the home. Dettol soap if you want you keep, or if you have, you are too much brainwashed by Dettol ads, then make sure that you dilute that Dettol 1 cap in a whatever that thing is, and then only use that whitish looking Dettol solution, not the brown Dettol that comes in the bottles. Okay. And I felt really positively elated once because one mother came to me with her child with a graze like this, and in the clinic I asked her, Dettol bilayal na? She said, no, somebody had told me, and She was a B.Ed student that time. Now she is a teacher and a mother. Somebody had told me in the first aid class that Dettol can be dangerous. So I felt I had done something worthwhile in life. Thank you so much.
I think if there are any questions on this particular topic, students were asked to put the questions on the chat box. If there are, then we can take up a few of them as we are running out of time. I'll ask.
I finished.
Yeah. Yes. No, we started late, no, sir. Any questions are there, Prajakta? If somebody wants to ask any question, any student, you can put on your mic and ask a question so that the questions are answered. Till then, I have a question, doctor. You spoke of all the buns. Usually in the kitchen, oil, hot oil, if it is.
It's type of scald.
Yeah. So, same, we can
Cold
use water. Keep.
It's purely physics. Cold water will reduce the temperature, no? So the further burning will stop.
And after that, the after effect, if the mark remains, then anything can be done. Then plastic surgery we have
This
to
is
do.
what I said. That's why burns are incurable. Anything in our body that causes a significant injury will leave you with a
Sir,
scar.
if you don't mind, you can come
Will
here.
leave you with a scar. We can do things subsequently through plastic surgery to minimize the scar. But every time I do a surgery, I'm creating a new scar. Nothing can heal without scarring. We can try and reduce the scarring, but it will never become zero. So that's why the prevention is the most important part. Do not get burnt in the first place.
We have this type of accidents in our houses, in our schools, anywhere we go. And today, a doctor has told us few tips what can be done, what will be the first aid in bleeding, in burn injury, all these things. For such a beautiful presentation, we need to thank a doctor. I invite Ms. Akshata Samant, Assistant Professor in our college, to propose vote of thanks.
Good afternoon, everyone. On behalf of GVM's Dr. Dadavaidya College of Education, I thank our officiating principal, Dr. Jojan Matthew, for inviting such eminent personalities like Dr. Raju Usgaokar and Dr. Nutan Dev, whom we will hear within a short time. I thank you, sir, for complying with our request to be the resource person for today's talk. As all of us have witnessed, right from the 8-arrowed pointer to his what he calls his favorite or peeves, to the practical insights that he has given us have been really, really helpful, as not only as an academic requirement this first aid talk is, but I'm sure it's a life skill which we have learned and we will apply it in our daily life. Hope we won't have to apply, that never such occasions come. As what sir says, prevention is better than cure, but if at all we encounter such incidents, then yes, we have the know-how how to deal with it. So I thank you, sir, once again for enlightening us. Thanks a lot. I hand over for the next. Thank you.
We have our doctor, very own doctor. She always comes to our college to deliver talks on first aid. I request Ms. Hani Babu to introduce our next doctor, Dr. Nutan Dev.
Good afternoon all. We will have a 5 minutes break. After that we will start with the second half of the session. Good afternoon, everyone, and welcome back to the second half of First Aid Workshop. I'm privileged to introduce the resource person for the second half of our session, Dr. Nutan Dev. Doctor was born and brought up in Margao. She passed her MBBS and post-graduation in child health at Goa Medical College, Bambolim. She worked for Goa Government Health Services for 32 years. After taking a voluntary retirement in 2017, she served as in charge for Health Center Ponda, that is our ID hospital. She has worked in various parts of Ponda Taluka and she has been rendering her services for social organizations and NGOs for the social cause like Dillasa, Lions Club, Rotary Club, Madruchaya, JC, etc. She has proved her expertise as a doctor. At the same time, she has proved her skills like in the poem writing, articles, and also published a book of poetry titled Abal. She has been honored by Rotary Club, Lions Club, and also honored by giving an award by Logmat Daily titled Urjita. After her retirement, she also continued to be a learner and did a certificate course in child and adolescent psychology from Vidya Prabodhini Institute, Pune. 3 years distant learning course was also done by her, and she also likes to read books, play table tennis, sing, and travel. All these are areas of interest for her. Doctor is now rendering her services involuntary to Dillasa, IMA Ponda, Swarnath, a pre-primary school for hearing impaired children, to Bal Kalyan Ashram, a boys' hostel under Madhurchaya. She also opened mind to share her expertise and deliver talks to the children from KG standard to the level of professional colleges. So we are so privileged to be here, ma'am. So on the behalf of GVM's Dr. Dada Vaidya College of Education, we welcome you, Dr. Nutan Dev.
Thank you. I'll take over. So, good afternoon, all. I know after a exhaustive talk by Dr. Raju Usgaokar sir on burns and wounds, which in fact it was a medical level talk. I will talk to you on various topics which you will need in your day-to-day school life. In a school, as a teacher, you are a guardian for the child for that particular time till the child is with you in the school. So you have to look it in that perspective that you are fully responsible for whatever happens to the child. First aid, now this talk is in your curriculum not just because to get some marks or something like that or a certificate for you, but it is in perspective for the children that you will be coming across during your tenure. And you should know to give the first aid for whatever happens to the child. In that perspective, you can think even of your own children at home. So you will be benefited with these first aid talks on both the aspects, at home and in the school. Now, as I will give you all the things as the student you will come across various students in different situations. Now, first first aid is the aid in help given to any patient, whether it's a child or an adult,
and it's a golden time. We call it golden time because it is hardly 10 to 15 minutes that you have to do whatever you know the best, and not hamper too much in it, and make it worse, but see that you utilize this 10 to 15 minutes of golden hour, and as fast as possible shift the patient to the nearest place where he can be given the further treatment under cover of medical services. So that is the importance of the first aid. Okay, so now first thing we will take some bites. One is commonest cause is the child is gone to the toilet or on the ground somewhere, and some stray dog comes and bites the child, and child comes running because there is the pain, there is a wound, and there is a bite, there is bleeding, and child is worried, child is scared, and the child will come running to you and telling, madam, I got a bite from dog. So what you will be doing, what will be your reaction? First and foremost, if any bite for that matter, don't get panic. You make the child sit coolly, give some water to drink, and make it comfortable under. If it is warm, you just put on fan and make the child comfortable. You can even take the child on your lap. Don't worry that the bite which the germs which are there on the wound will come to you. Nothing of that sort. Okay, so you just make the child comfortable as much as you can, and then within few 1 or 2 minutes, once the child is settled little bit, you can take the child to washroom and just open up the tap, or if there is no running water for the tap, just take a mug and just see that the water is poured on the wound continuously for 10 minutes. It is not just washing the wounds. We can wash the hand within 1 minute also. We can wash the wound in no time, but here we are washing the wound thoroughly so that maximum germs, in case if the dog was rabid and the germs are there which are there on the in the saliva of the dog, they come in the wound of the child. So wash it completely. Don't worry about the pain, don't worry about the bleeding. If it occurs, don't worry. Even if the wound is bleeding, we have to put running water on the wound and wash it. Once it is washed, just clean it with just sponge it like, and with the pressure you just clean the wet part and tie a clean bandage around it and take the child to the hospital. So this is the only first aid that you can do for a dog bite. Once the child in hospital, the child will be received in. Whenever there is a wound and there is a bleeding, what we do? Doctors normally give a suture, but dog bite is never sutured. Even if it is bleeding, we see that the bleeding is stopped in some other way, but if the bite is too deep, as the doctor had told you, if the wound is too deep and if the artery is bleeding, then only that artery we can suture, but otherwise the wound, however big it is, the wound is left unsutured, because the suturing will create more problem. The more nerves will be damaged with the rabid germs. Okay, and then once the rabid germs enter our body, they will destroy our brain cells, and then the child has no hope of living. The child dies. Remember, dog bite from a rabid dog is very serious. There is no treatment for it. The patient dies if the treatment is not given within I must say 8 to 10 hours, not even 24 hours. Most of the time we neglect. We say, अरे वो तो रोज आता था हमारे घर के पास, हम उसको खाना देते हैं. लेकिन sometimes that dog must have been bitten by some other dog or some wolf if they go out in jungle and all, some fox, and then the virus which is required for this rabies comes in the body of that dog, and through saliva it comes to the patient. Now you may say that how if the child is having the rabies, whether that child will give that rabies to me? No. Human to human is not, transmission is not at all there. So we need not worry. It is not like our this recent coronavirus. So you need not worry about this virus. This virus, even if the child licks you, while suppose if a small child whilst crying, if the child wants to goes in tantrum, and suppose the child bites you, even if then you will not get the rabies virus through the child. So this is, once the child is in hospital, as I said, the wound is never sutured and the child gets anti-rabies vaccine. So these 5 injections are given as per the schedule. It is not daily injection. It is 0, 3, 7, 15 days. It is like the schedule is given, and accordingly the 5 injections are given to the child in a period of 1 month. So this is dog bite, and which very common. Sometimes even if the normal house pet, the dog sometimes we keep in the house as a pet, if that pet dog bites the child, and if you are not sure that whether the dog had gone somewhere out and without your supervision, then you have to take these injections, because as I said, if you get rabies there is no treatment. But sometimes whilst playing in the house, the child is just licked by the dog, or sometimes the child even get the bite, but the dog is completely immunized, dog is completely normal. This was just as a fun, or even the dog, they like to enjoy with the children. So just whilst playing, suppose if the child gets a bite, a minor bite or a lick through the tongue, you need not worry. Okay, provided your pet dog is supervised for his walks, for all his whatever he wants to go and pass the stool and all, you carry the dog, or second thing is the dog is vaccinated. Okay, so now we will go to next bite, that is snake bite. Snake bites, as Sir had in his in starting only he said that in Kerala there was in a school there was a snake bite. Okay, so you can take as per your this thing. If you are having a problem, okay. No, so first aid. Okay, I'll go as per this. I'll go. So now next the snake bite we'll talk little later. As per the slides, I will go through diabetic coma. Now, as I said, diabetic coma is nowadays we see even the children with diabetes. Why this topic for you? Because diabetes we see in elderly. Why we need first aid for diabetic coma? But nowadays there are some children with diabetes in the school. So first and foremost, it is your duty to know whether, if as being a class teacher, I am just putting it to you, each and every child is your child for that particular time, and as a class teacher you are responsible for this. Every class teacher, if is made for responsible for her class for 35 to 45 students, okay, you should know about the children fully through their parents. There are so many PTA meetings and all, so you should know which child is sick, which child is on treatment, which child is problematic with the health, okay, not with their character and all, but with the health. Which child is taking regular medicines, that you should know. And I'm telling you, this is nothing big, because out of those 45 children, hardly there will be one child who will be taking some treatment for a chronic illness. Chronic illness means lifelong illness. Some may be with some cancer, leukemia, okay. Some may be with diabetes, some may be with renal conditions, okay. Some may be asthmatic, दम येता म्हणटा न्ही, asthma, okay. Some may be with some allergic reactions. So each and every child, you should know in your class what medicines the child is taking. This is for chronic, and sometimes it is a short disease like fever for 2 days, just viral plain fever, okay. So even then you should know whether the child is sick or not. Any child who is sick will not be as active as usual. It will be little quiet, it will be sitting quietly, okay. If a child is having fever, it will be not in as the child is in normally you see the child, okay. So in your school there must be a first aid box, not only with first aid tapes and as said Dettol and some antiseptic lotion cream, but also with some paracetamol tablets or syrup, also with some sugar and ORS packets, electrolytes, okay. Also with some medicine with wheezing, with asthma you can, which are very common medicines and anyone can give if you know the first aid. Now that after this you are all first aider, you can easily give this medicine. There is no need of worrying, because if you give 5 ml of syrup of crocin or half tablet of crocin, nothing to worry. Instead, you have to do it till the parents come and take the child, or you take the child to the hospital. Okay. So even giving this some of these medicines is a first aid. Okay. So as I said, in diabetes, what happens? Diabetic coma is unconsciousness. The patient goes in unconsciousness. Patient doesn't know what's happening and it just falls down. So one thing is, we can say diabetic coma is either when the blood sugar is very high, okay, and otherwise blood sugar is very low. Only these two conditions give us coma. Okay, it is either hyperglycemia or it is hypoglycemia. Now normally in children, they come with some tablets or some insulin or whatever if they are diabetes, and they have not taken their breakfast properly, and they go in lowering of sugar, hypoglycemia, and they get a fainting attack or a deep even in they can go in coma or unconsciousness. But mostly before going to coma, they directly don't go in coma. They will feel little bit drowsy. They will feel fainting attack. They will respond to you. In coma, they don't respond to you. They don't know what's happening around them. But with minor dizziness, they will call out to you. They will tell, "Madam, I am not feeling good. I am feeling like fainting," and they will sit or they will lie down. Okay. In such thing, first and foremost, whether it is, and you don't know what's happened, but if you know this child is diabetic, then you will do one thing for this child. You will make syrup of sugar or glucose and give the child to drink. So now what is the another thing we have to add in our first aid kit is a powder of sugar or glucose, Glucon-D or whatever. A small packet of Glucon-D should be there in a first aid box. Now you will say that if the patient was with high glucose and if you have given another addition of glucose, won't it harm? So it is no. even for elders, you should, even at home, suppose if you have an elderly person and with diabetes, and if he feels like fainting and if he sweats, then first and foremost you have to give glucose, because if the sugar is high and if you give little bit of glucose, it won't make much damage. Okay, it's already high, you are adding a little bit. But if the sugar was low and if you give glucose, then you are saving the person. If glucose goes down very much and remains like that, the patient can die. But if glucose goes high and if you give another dose of glucose to drink, then it won't kill the patient. You understand? So diabetic coma is in both conditions, when there is high rise of sugar or lowering of sugar. But giving sugar to drink or to just to swallow, it will help the patient from the and prevent the death. So you are saving one life just by knowing this one sentence, and this is the first aid. Okay, then further you can take the patient to the hospital to check the blood, to check the blood sugar level, to give the drips, whatever IV fluids. Okay, so that is next part. Now next we'll go to, see, this is all present. Okay, I'll just tell you what is the normal. So our normal blood sugar is 80 to 120. Okay, and random means anytime, suppose if we have food and just check our blood sugar, it can be 130, or it can be, if we check soon after 1 hour after food, it can be 145. Okay, but the dangerous level is 60. If blood sugar goes below 60, the patient can die. Okay. Now this term shock is a condition. In fact, when we talk about shock, we always think of electrical shock. Okay, so it is not electrical shock as such. Shock is a condition when our cardiovascular system, okay, it fails. The whatever perfusion, whatever fluid goes through all the and blood, fluid is blood in our body, which goes through all the parts of the body, is decreased. Okay, with blood supply decrease to all the parts, all the organs become little bit sluggish. Even our brain, our liver, our lungs, because the oxygen is not supplied as much as we need. Okay, blood supplies oxygen to our body. Though we breathe oxygen through the nose, it goes to the lungs, but from lungs it is absorbed by the capillaries into the blood, and then it is that oxygen keeps us living. Once this shock comes, then this perfusion, this oxygen going to various parts of bodies is very much decreased because of lack of fluid going through the parts, lack of blood going to the different parts, and especially the brain. Okay, just before going to this shock, I will tell you one common thing which happens in the school. Shock is the what I can say, end of the lack of perfusion. Okay, if too much of loss of blood, suppose now recently just in the afternoon doctor told you the wound, if it keeps on bleeding, then patient goes in shock because there is hardly blood left in the body. Okay, so then that patient can die. But before going to that extent of shock, we will just think of the initial things, just that is a fainting, which is very, very common in the schools. Okay, now why this fainting happens? Fainting can be as, it is, the reasons are almost same, fainting and shock. There is either loss of blood, there is loss of fluid. Okay, suppose if there is vomiting and diarrhea for a child, okay, Now our blood contains 70% of blood is water. Almost 70 to 80% is water, and rest is plasma and blood cells. Okay, but most of the part of our blood is water. So if because of this diarrhea and with vomiting the child loses water, okay, the blood becomes concentrated, and there is the perfusion is the supply of blood going to various part is decreased. So that can give to shock also if it is too much, but to initially at initial level it gives rise to fainting. You followed? So we, and fainting as I said is very common, shock is not that common, and you need not worry about the shock in your school unless it is a severe accident where there is a sudden loss of blood, okay, which is very very rare, but fainting is very very common. So one thing, when the child feels sick, the child complains that that the child cannot stand, or even when the child is sitting on the bench, if he just makes some movement like and he falls, okay, you have to first and foremost you have to loosen the clothes. If the child has a tie, because in some schools there are tie, loosen the tie, try and loosen some buttons, okay, if it is too tight, and make the child lie down on the ground, totally on the ground, don't worry about the dirt and all, okay, and lift the legs at a 45 degrees angle. So if the child is like this, like, you have to make the child lie down, and the legs should be at this level and the head should be at this level, okay. So whatever blood supply is there going into the skin, going into the peripheral tissues, legs, all will come to heart and to the brain, okay. So and our brain is our powerhouse. We have to save our brain, giving the maximum blood supply, and then you can give the child to drink some ORS. ORS is, you all know now, ORS is a really lifesaver medicine. Whether whatever may be condition, whether the child was vomiting, whether the child was having loose motion, whether the child had not eaten anything in the morning for breakfast, or whether the child was standing for too long standing in a for some period, for your some you have a, what you say, in the morning hours you have all some function and the child was standing for too long, even then you can, the child can faint if the child was little sick. With a little bit fever also, if the child remains standing for long, he can go get a fainting attack. Okay, so now we have to see that the brain is safe, and then make the child sit, give child to drink something, especially the ORS, if ORS, and now again we have to keep some ORS in our first aid box. Just 2-3 packets are enough. You have to replace them if they are over. Okay, so now this shock, as I said, can be because of one is neurogenic shock. Neurogenic, sometimes another condition when the child can go in shock is suppose if child is playing, running, and suddenly if the child hits the nerve, and these some nerves are very superficial. One nerve is here, okay, or even the head at the neck, okay, some parts, or even for boys at testes, gonads, okay. So if they get that hurt, then they can get a severe pain, and with this severe pain the child can goes in shock. This is called neurogenic shock. As I said, with vomiting and loose motion, the volume of blood decreases, and that we get hypovolemic shock. So there are various kinds of shocks, but we should know what is wrong with the child, what has happened. Suppose while playing, if he has hit the ground, or he hit the bench, and then because of pain he is gone into shock. But whatever it may be, you have to make the child lie down and raise the legs. That is the first aid. Okay, we'll just go through the slides. See, now, if not treated swiftly, as I said, vital organs such as heart and brain may fail. So you are saving a child just by making the child lie down and raising the legs at the first level. Okay. Then this I said as nervous, severe bleeding. Okay. Bleeding can be because of any injury. Then sometimes the child itself may say taan lagla because of the some bleeding or sometimes you don't see the bleeding is inside. If the child hits with a what we can say too much of banging, or whilst playing cricket, suppose the season ball hits the abdomen, okay, that can be a severe pain. Or just a kick by some another child can be a severe pain. Okay. So, and now this is another shock which we say anaphylactic shock. As I told you, there is hypovolemic shock, your neurogenic shock. This is anaphylactic shock is another condition where the child is having some allergy. Okay, and allergy can be to any object. And the child, suppose if the child is severely allergic to milk, I am just giving us a common condition, or not common, a common thing which we use daily. Okay, severe, if the child is known for severe allergic condition because of milk, and if the child is given milk in a class, okay, as a midday meal or whatever, okay, child can go in anaphylactic shock if he is severely allergic. But mostly anaphylactic shocks are seen with some bites, okay, some sting of some bites or some injections. Okay, in our casualty, if suppose we don't know about the history of this anaphylaxis, and if we give the normal medicine, in fact the medicine injection which we give can be a routine one, but that injection can cause allergic reaction in this patient, and the patient can go in anaphylactic shock, and this shock is very serious. We have to treat it as per the condition. Okay. Now we'll just this heat exhaustion and stroke. Similarly, cold, too much cold, and frostbite. These both conditions are more or less in are similar. Either you are in some place where there is too much of ice and you are not used to the ice, okay, and where there is too much heat and the person is not used to heat. In Goa, our climate is such that there is neither too much of heat, neither too much of cold. So we are very much safe with regards this. But suppose if you are making a child, sometimes just for punishment purpose or something, you keep the child in the hot sun outside the class. Nowadays we are not supposed to beat the child with the ruler. So if you feel that you should give punishment, chalo ground पे जाके खड़ा होके रहने. So be careful when you give such punishments, okay, because too much of staying in the sunlight can give rise to stroke, heat stroke. Okay, what happens, the child thermoregulatory जो mechanism रहता है, sometimes in a younger child it is not fully developed. Okay, even for adults for that matter, if too long if you stand in the heat, you can get heat exhaustion and you can go in stroke, and that is similar like another shock which I told you, shock condition. Okay, so you have to be careful. So now here I will like to tell you one thing about a fever. Okay, what happens when there is, you don't know, the child is having fever in the morning and the child is pushed to the school by the parents just with a spoon of crocin or something. But when the child comes, the child gets still higher temperature in the school. So if the child, such child is always drowsy, as I said, and not as a normal child, you should check the temperature just by your palm. Okay, just feel if the child is having temperature. Sometimes, and another thing to know whether the temperature is rising or not, is body is warm and the palm and the feet, sole of the feet and the palm are completely ice cold. Okay, very much cool comparing to the body is warm and the palm and the soles are cool. So you should, that time you should, it should strike your mind that the child is getting fever. Okay, and the child is drowsy, child likes to sit and is not as normal. Okay, so at this time you should give some medicine for fever. Whether it is, even if you are not sure that the child is having fever, or you may think that the parents may shout, why हमारे बच्चे को क्यों medicine दिया, nothing like that. You have to give. You can explain it to your principal later, but you have to give the medicine and see that the fan is put on. Okay, if there is no fan, AC है रूम में, किसी के रूम में, प्रिंसिपल साहब के रूम में, तो you can shift the child to AC room. You have to bring the temperature down, or you can put on the fan, or even if दोनों भी नहीं है तो just take a tap water and sponge the body of the child so that the temperature doesn't rise further. Okay, so this is by the side, but same thing I told you this in connection with this heat exhaustion, because if the child is kept outside in sun or is heat exhaustion case, you bring and do you same thing what you do for fever. Okay, that's why I told you this. Just give the bath of cold water, or sponge the body with cold water, or just put on the AC, or you put on the fan. Okay, so that the body temperature comes down. See, as I said, the child is not normal when there is high temperature, whether it is because of the heat stroke or whether because it's a fever. Child will get headache, dizziness, and child will be bit confused, sort of, doesn't know, restless. Confusion is restless. Okay, or either restless or drowsy and wants to lie down. Okay, this loss of appetite, nausea, we don't have to think much because that can be any time. So heat stroke, as I said, is normally not seen in the schools because children are inside. But if the schools are such that the ceiling is of asbestos sheets, and there is congested rooms with low ceiling, and outside temperature is in, like in our northern states, in Delhi and UP and all, it goes to even 49 and 50 degrees Celsius, which is very high. Okay, so in Goa the maximum temperature, highest temperature, I think doesn't go across even 32. So we are very much safe. Okay, see, this is same, quickly remove to a cool place. That is the first thing, and try to minimize the clothing. Suppose the child is with too much of 2 t-shirts and all, you see that the child is kept minimum clothes on the body. Our normal temperature is 37.5 degrees centigrade. Okay, normal body temperature. Then poisons. Now in school, if we think of these poisons in the school, the poisons can be through food. Okay, poison can be through injury. Suppose if the child is fallen and there can be some uh, toxin outside which is come to the body, tissue injury. Or if the child is, sometimes they like to go out in a group and they find some nice fruits, especially datura. Datura tree is a small plant, is a shrub with a nice looking fruits which are very much poisonous. And mostly the 2-3 children at a time, they think that it is a nice fruit and they eat, they share it with amongst themselves. And many times we get these types of patients. So anything, if the patient has taken through mouth and you feel the patient is drowsy, first for any first aid you have to first call for 108. Okay, first thing you have to do is call 108, so that by the time the vehicle comes, whether 10 minutes or half an hour or 1 hour, that it depends on that is their responsibility how fast to reach. But you have to first call 108 if you have slightest doubt. Don't worry that they will, if the patient sits after 108, sometimes the child sits and starts playing. Don't worry about that. Let them come. If you have doubt, you please call. Okay, don't think that if I call and if the child is okay within some time, what to do, they will laugh at me. Don't worry about it. Okay, it is your duty. You have felt that the child is sick, you have to call either parents or 108. Okay. So what I was saying is, these fruits, eating of fruits which are poisonous, you can't do much. Only one first aid you can give for these is salt water. Okay, if during interval time the children, 2-3 children have gone out, students, and they, whilst playing on the ground, they find these fruits and they eat, and they come to your this thing, and then they can say vomiting, feeling like vomiting, feeling little drowsy, they can say. So you can only give them salt water. Take a glass of water, put 2 teaspoons of salt, make it quite salty, and give them to drink. So when they drink this salty water, there is automatically nausea and vomiting, and the child will vomit whatever is eaten as much as possible. Okay, and if suppose child doesn't vomit and the salt water remains in the stomach, no problem, it doesn't make any harm. Okay, but it will help if the child vomits, some of the contents of this poison will come out, and soon we have to shift to the hospital and give the stomach wash and whatever we do it, that is doctor's duty. So otherwise normally we don't come across much poisons. One poison we can say in the household is very common, is drinking of kerosene by a 1-year-old child, 1 or 2 year or 3 year, because nowadays kerosene comes nice blue color, and some houses keep it for some purpose, either for their stoves or for some I don't know, but they have one bottle of kerosene in kitchen somewhere, and that is also kept on the ground floor. And the child which is of that height, 2 years, 3 years, it must have seen the elders taking bottle and drinking. Okay, कुछ तो लिमका बिमका पीते उन्होंने बच्चों ने देखा है. So they just lift that bottle and they drink the kerosene. Kerosene poisoning is very dangerous in children. Okay, so this is another poison we can say that the child we see commonly. I am telling you all the common things that are happening and what you can do for this. Okay, so now this kerosene poisoning will not do harm if the child has already swallowed, will not do any harm at that time, but it gets absorbed in the blood and the child gets, it goes in the stomach, but through blood it goes to lungs and the child gets pneumonia and the child is breathless and that also happens after some 18 to 24 hours. So आज इतना सा पिया था वो, अभी ठीक है, खेलता है, अच्छा है. If you say that and keep the child at home, the next day you will get the child with breathlessness and severe pneumonia, and the child can die. So whether whatever is done even at home, if you know the child has taken this kerosene, drunk it, whether it's 5 ml or 10 ml or 15 ml, that doesn't matter. You have to take the child to the hospital and wash, give a stomach wash. Okay. See, these are some of the poisons they have mentioned, alcohol and potassium cyanide, and all these are not that common in our day-to-day life and not with the children. And as doctor said, prevention is the best thing for poisoning. Okay, you have to keep all the poisons. We have seen children, because a mother is given some iron tonic, okay, and the children and the iron tablets are coated with sugar, they are quite sweet. So when the children play in a group in their house, they find these tablet strips and they keep on chewing the tablets and they keep on taking these medicines which they find in the cupboard or somewhere close by, close to their hands, and they get the poison of iron. So all these things are preventable. Then industrial poisoning is another big topic. You must be knowing that Bhopal tragedy, which was some 40 years back, I think it is almost 50 years back. It is still the patients, the effect of that, or we can say, is still on the people around in those areas. So alcohol poisoning. Sometimes the children doesn't know, the father must have taken some drink and it was kept, and if the child drinks, the child can go in depression with CNS activity all going down and can go into unconsciousness. So now whatever may be, whether it is shock, whether it is poisoning, whether it is injury, if the patient is unconscious totally, okay, we are not supposed to give anything. I told you to give sugar, I told you to give ORS for all these, provided the child is responding to your commands. उसको नाम से पुकारा बच्चे को, तो he should, at least he should said okay. If he doesn't respond, then we are not supposed, and if he is totally unconscious, we are not supposed to give anything orally, because that will worsen it. The whatever we give can go to our lungs, okay, because our oropharynx is and our laryngopharynx both have a same one lid, epiglottis, okay, and instead of swallowing going in the stomach, it can go into our lungs. So unconscious patient should not be given any first aid for that matter, unless it is some wound which you can tie or okay. Continue treatment. Now see, I told you, if unconscious, never feed anything by mouth. Okay, neither you induce vomit, try to put something, fingers and all in the mouth and try to induce vomiting. Okay, then keep the, as I said, actually head low position, we say we have to lift the leg and so that the blood supply is maximum to the brain. Now giving this oxygen, then giving this CPR is a bit complicated. We can't expect everything to be there in first aid. Okay, so we will, oxygen is not a thing that we keep in the schools. Then carbon monoxide presentation, carbon management. I can't find that snake bites. I'll just scroll and see. This is all taken by Dr. Now, dog bite के बाद we have started from first topic. So, as per these slides, I am going. This is a coming again, diabetic coma, shock, again they are coming. See if you can, yeah. In meantime, I will tell you about the snake bites, because I think we will almost done. And then there is CPR. Okay, so CPR is very important. Just see, snake bite I can talk without the slide, but CPR if you can show, it is better. Snake bites is, see, there are two types of snakes for our purpose. There may be various types of names of the snake. Green snake, harivali, cobra, viper, crate, various names may be there, but for our purpose there are two types. One is neurotoxic snake and another is hematotoxic snake. Okay, so hematotoxic, hemato and blood, neuro and nerves. So when it is hematotoxic, our blood is with the poison of the snake, our blood is damaged. Okay, and with neurotoxic, our nerves are damaged. The poison which is given by the snake is either neurotoxic or hematotoxic. Again, there are another type of bite, snake bite, poisonous and non-poisonous. Okay, so non-poisonous snakes are also very common. But looking at the sight of the snake, that makes themselves sick, and because of the fear of the snake, the patient can collapse, though there is no poison at all. Okay, so non-poisonous snakes, poisonous snakes. Now, how to identify these non-poisonous and poisonous? Whenever there is a poison given to our body, poisonous snakes, then there is the site where there is bite, there is redness, there is discoloration of the skin. It is either, sometimes it is blue also, but there is swelling, okay, and there is pain, and there is some redness, and most important is the two fangs of the poisonous snake. Poisonous snakes have the fangs through which the poison is given as an injection to the patient. So those two dots, black dots, will be seen clearly. We don't have to think whether it is viper or crate or whatever, because the medicine is same for any poison. Okay, whatever medicine we give in the hospital is a combination of all the anti-snake venoms. Okay, whether it is this or that or that. So we don't have to think of but we should identify whether it is poisonous snake bite or non-poisonous snake bite at the site. That is for the first aid. So, as I said, there are two fang marks, two black dots. Okay, you can clearly see with the swelling of the part. Either it is bluish in color or it is reddish in color, and there is a pain. Whilst non-poisonous snakes don't have those fangs. They have a teeth like us. Okay, and the bite which is seen is, you can make out those teeth impression on the skin. Okay, and this is non-poisonous. You can only see the teeth nicely, they are seen on the skin, and without any swelling, without any pain, without any discoloration of the skin, nor blue, nor black, nor red, nothing. Only the teeth mark you can see very clearly. Okay, so you need not worry if this is there. But if you see swelling, if you see the two fang marks, you have to think that this is a poisonous snake and you have to shift the patient to the hospital as fast as possible. Now, as I told you about dog bite, we can wait for some hours, because not that, but we have to wash the wound. Here we have to wash the wound, but it is not as much as dog bite, but we have to tie a tourniquet, which is not a fine string. It should be a 1-inch broad tourniquet. It is to be tied proximal to the wound. Suppose the bite is here, okay, we have to tie it here closer to the heart, and it should be tied in such a way that if you tie it, now it should be like this much. If I tie this here, I should be able to put my finger. Okay, it should be not too tight, neither too loose. Okay, by the time, till the time you take the patient to the hospital, the tourniquet should be there, and the tourniquet should be such that, as per anatomy, our arteries are deep inside and our veins are superficial. So we should prevent the blood flowing from wound through veins to the heart. To prevent that blood flowing from wound to the heart, it is just veins that we have to make pressed, keep pressed, and not the arteries which are deep inside. If we put the string in such a tight way, and if we compress the arteries, then there will be more swelling, there will be more danger to the wound, and also for the circulation. You followed? And this ligature which we tie, this band which we tie, should be not kept for more than 2 hours or something. If the distance, suppose if you are staying here and you have to take to Bambolim, then we have to be, at least we take 45 minutes to 1 hour. So in between, for half an hour, you have to release the tourniquet for some time, tie it again. Okay, keep for 2-3 minutes off, put it again. Okay, so maximum time half an hour we can keep the ligature, and the ligature should not be too tight. These two things we have to remember. And once, because you can't, many times in movies and all, they show the cuts are given, then they suck on the wound so that the blood poison is, nothing is to be done. Okay, so a maximum, I think, if you can just see, if you can give a little bit of small clean blade, new one, and you can just give a small cut if you have that guts to give the cut. But with the blade, if you cut the artery, you will be in trouble. So better not to give any cuts, only thing ligature, and wash the wound and take the, don't apply anything, because those fang marks should be seen by the doctor, and go to take the child to the hospital. Okay, so poisonous snake, I told you, whether it is hematotoxic snake, whether it is neurotoxic snake, the toxin is different. All different types of toxins are taken care by the same medicine, anti-snake venom. Okay, this is tourniquet to be tied above the bite, and no roll of tourniquet if hour or more. Okay, but mostly, as doctor said, we reach to any our bigger hospitals within, and mind you, this anti-snake venom is available in all, even primary health centers. Even the small hospitals of government hospitals, they are supposed to have these in their refrigerators. So it is nothing much this thing to be Many times what the peripheral people do, they tie the string in such a tight way that even if it is non-poisonous snake, the hand is fully swollen because of there is no circulation doesn't occur, and there is a congestion in the hand. The hand is reddish. The snake was non-poisonous. Okay. Now I think last topic we'll take is CPR. CPR is cardiac pulmonary one. Okay, shit, that topic is left. Foreign bodies is very common. Foreign bodies in eyes, nose and ears. I'll just give you one example. Okay. If there is a foreign body in the eye, we can do one thing, just pull down the lower eyelid, and if you can see the foreign body, mostly it is a eyelash or some minor some dust or something, and that will, you can take it with the handkerchief, or you can just splash some water, or you can make the child blink in a plate of water. Okay, just get a bigger plate with water and put the eye in the water of the child and tell the child to blink. Okay, you show the child how to do it and it will go off. But if you can't do, or if you can't take, don't try to do manipulate it. Sometimes we with the more of interfering with the wound, with the foreign body, you can give a wound to the cornea, which is dangerous. So you can take the dog to the doctor. It is not a bigger emergency, but the wound can be easily taken at a ophthalmic level. Secondly, the foreign body. The foreign body in the nose. Now, this also, sometimes at home the parents and even in the school, if there is some chalk they put in the nose, or sometimes there's some chana they can put in the nose. So, you make it such that you don't put anything, introduce anything in the nose, on the nostril where there is a foreign body, because it can go inside further and that is dangerous. Okay, one thing you can do, you can just tickle the nose in the on the opposite side, nostril of the opposite side. So with that tickling the child can get sneeze and the object most of the time comes. especially if it is a recent one and if it is a chana or something like that. But if it is a chalk, it can get a swollen inside, and that's why it may not come. Don't try to manipulate and remove it with the some stick or some bud or earbud or anything. Okay, you don't interfere, let the doctor take it out. Okay, but it is an emergency. Then foreign body in ear is not at all an emergency. Even if there is some foreign body, sometimes many times patients come at night time because some flea or something insect has gone in the ear, and at middle of the night at 2 o'clock or something, it is not an emergency. Even at home, school, you can just inform the parents and put some oil in the ear, okay, so that that insect gets tangled in that oil. It doesn't proceed further inside, it remains there. Okay, then either you can put oil, or even if there is no oil, you can just put few drops of water. It doesn't harm, both these things won't harm. But don't try to remove it with some earbud or something. Even if you can see, okay, don't interfere, because if it goes inside, it will perforate our tympanic membrane, which is there, which is the most important part, one of the most important part of ear for hearing. And if you damage it, it may cause impairment in hearing. So better just for that, make the bee or whatever insect inactive, either put little bit of oil, especially you can put coconut oil, or just water drops. Okay, so these are the foreign bodies which are commonly seen in children, and you don't have to panic for all these three. Only thing we are worried of the foreign body in the nose. Okay, so if even sometimes, even at home they do these things, this mischief, and the child is brought after 2-3 days saying that there is bad smell of when the child is close by. Because of that foreign body, there is infection inside, and that gives bad smell. Then now the last topic we'll take is CPR. Okay, CPR, as I said, you can't just talk on it, you have to do it physically. Many times I was calling some student and we were showing how to do it, but we will see these pictures. You have that slide. Okay, now this next. Now this wounds and bleeding, this is not working. Okay. Dangerous wounds. CPR was last topic. Somewhere I think it will be there. Cardiac pulmonary resuscitation. It is full form is. Now what happens whenever I told you all these wounds, shock, sometimes patient is unconscious, and some worst is the breathing stops. You don't know exactly what to do, so that time we need this cardiac pulmonary resuscitation, which is very complicated thing to do. Even trained doctors get panic when you have to do CPR. So I don't, in fact, won't advise you, but as such, but just sitting idle and doing nothing, if the patient is in shock and if the patient is unconscious and if the respiration is stopped, you can better do something. Okay, so that's why we will talk a few things. One thing is you have to put the patient on the ground. This CPR is cardiac pulmonary resuscitation. Here the respiration is stopped. Either respiration is stopped, patient is not breathing at all. Okay, but heart is still there and brain is still functioning because heart blood supply is there. But as the respiration is stopped, oxygen, new oxygen which is to be supplied is not coming. Okay, the patient is not getting oxygen through the lungs. That's why the patient's brain is not getting oxygen supply, and that's why the patient can die. So one thing is we have to sit by the side of the patient, okay, kneel down and sit by the side of the patient, and suppose if the patient is lying in this way, you just make the patient lie down without any pillow, and just put your hands on the chest of the patient and press it, okay, so that you just give 1, 2, 3, or this is for a small child I am talking, okay, you just press the chest and give a blow in the mouth. You have to take care, you don't have to worry of HIV and all things, because nothing can happen, no infection can come to you through the mouth blow, okay. You just take a deep breath and blow in the mouth of the patient, especially the child. Now for elders, we put both our hands one on the top of other, we keep on the left side where there is heart, okay. Patient is lying down, we are sitting by the side of the patient, both our hands one on the top of other is on the heart of the patient, and we are pressing it fully, so that it goes almost an inch down, okay. Don't worry about the breaking of bones and all, just press it 1, 2, 3, and then you give a blow in the mouth. Why this we have to do? Because our heart beats 70 to 72 times and our breathing is 16 to 18. So every one breath is our three times pulse is one breath. So you give 1, 2, 3 on the chest and give one blow through your air which you have taken inside, you give it out for the patient. So this is in short CPR, okay. With this what happens, you are activating the heart which is almost going to stop now, and you are blowing whatever, it is not oxygen in fact, you are in fact blowing carbon dioxide, but with that activates the lungs, okay. So the patient starts असे जातं पेशंटाक, and we have seen that the patient who would not have received this CPR would have died, just takes a breath and then it comes to normal, okay. Then you can shift the patient to the hospital and then you can give the oxygen, but once that one breath comes of the patient, you have done lots of things just because of with this in 5 minutes time. So this is in short CPR. It is very easy to talk on CPR, but it is very we even ourselves we really go in shock when we do in this procedure, because we don't know whether the patient will come out of the shock or this depression of respiratory center and all. But when the patient starts breathing, you are really you feel that you have done something very nice thing, and you feel nice about it. So in short, I think we have covered almost all the topics, and all the best to you. Make a as soon as you are appointed as a teacher, see that your class, as a class teacher, you know your students, you know their physique, you know their diseases, and you keep a kit for yourself, if or a school can provide with a kit where you can keep all these which we have come across as per the topic, okay. Because many times in bus and all there is a box, first aid box, and open killer कायच असना भितर, okay. And it is not just the Dettol and the tapes, but you know all the things which you have to keep in the first aid, even the medicines which you can normally give without any harm, you can keep, you can ask a doctor for a prescription and you can keep, and you can just mention there what to give, especially when the children are below 10 years old. Thank you so much. Yeah.
Thank you very much, Doctor, for that beautiful presentation. As we have less time now, the PPTs which doctors have shared with us, we will definitely share with all the students. And it was nice that students have given the feedback. We will definitely answer back as students have to get the attendance also. Doctor, it was nice having you here. Now I invite Ma'am Akshita Samant to propose vote of thanks.
On behalf of GVM's Dr. Radavaidya College of Education, I thank first and foremost our officiating principal, Dr. Jojan Matthew, for organizing the first aid talk and inviting such eminent resource person like Dr. Nutan Dev. Thank you, ma'am, for complying with our request to be here. Now, I'm sure all of us here agree that ma'am has very ably equipped our learners with the knowledge, practical insights, and understanding required to provide appropriate first aid treatment in the workplace. Then it would be regarding bites like snake bites, shocks, poison, diabetic coma, heat, exhaustion, and now even the most difficult or the challenging part as a CPR. Now, I am sure that our first year and second year students have benefited from today's talk because not only was it an academic requirement but certainly an essential life skill. I express my thanks to Associate Professor Karuna Satadekar for her flawless comparing, Assistant Professor Vinayak More and Assistant Professor Hani Babu for introducing our guest speakers. I also express my thanks to Assistant Professor Diptesh Verenikar and Assistant Professor Prajakta Kavekar for all the technical support and all our staff members, office staff and non-teaching staff for making this talk a successful one. Thank you. We hereby declare that it is the end of this program. You can now log out. Thank you and have a wonderful weekend.